We are going to discuss about more in detail that how it will be helpful for the patient and for the doctor to find out the real causes, the treatment options. So many people are coming and complaining about the peripheral neuropathy.
Peripheral neuropathy is the dysfunction of peripheral nerves. Diabetic neuropathy, problems with low back pain. These two categories are the most frequent in our practice.
How you can find out there is a neuropathy?
The diabetic neuropathy, it's a group of different types of neuropathy.
So what the treatment FDA approved for this treatment?
There is a special group of medications which we use for the treatment.
Okay.
If the conduction velocity is reduced, it means that it's some damage. Gabapentinoids, pregabalin, gabapentin, duloxetine, they act on the mechanism of pain, not on the mechanism of regeneration.
So
Combination of nucleotides, there is a special group, and deficiency of B12 is a mechanism also contributing to the neuropathy.
And you need to be treat the condition, not the pain.
Yes.
So this is the very important message for today. Hello everyone, my name is Syed Yasser. Today we are going to start a new series of medical lectures or medical awareness. And this talk, name of this talk is called Health for Goods. So we are going to discuss about more in detail that how it will be helpful for the patient and for the doctor to find out the real causes, and we will discuss about the treatment options. Today we have a senior professor with Dr. Danilov. He is a neurologist from the Shechino University, Medical University from Moscow, Russia. Welcome, Doctor. Dr. Danilov has a clinical experience of more than 30 years, and he is doing so many work on the field of neurology. Today we invite Dr. Danilov. He come from the Russia to discuss about some of the medical condition, especially that will be useful for our audience and normal people. So, doctor, welcome to this program.
Thank you very much for inviting me.
No, this is our pleasure, and you are the very senior doctor, and you are doing so many research on the neurology. So many people are coming and complaining about the peripheral neuropathy. So, what is your the finding in your clinical practice? How prevalent it is?
Yes, first of all, let's estimate that the peripheral neuropathy is a dysfunction of peripheral nerves in our legs, in our hands, and the prevalence of these damages in population is about 2%, around 2%. But most frequent reasons or etiology of peripheral neuropathy is diabetic neuropathy, problems with low back pain. So these two categories are the most frequent in our practice.
So yes, you are right, because when we listen about neuropathies, come to our mind diabetic neuropathy.
Yes.
All people are thinking about diabetic neuropathy. So how you can find out there is a neuropathy?
Yes, the very good question, because the diabetic neuropathy, it's a group of different types of neuropathy which are related to different type of fibers involved in the process. So if small sensory fibers are involved, in that case, patients have pain and they come to doctors and they complain, tingling, burning,
Numbness,
pain,
burning,
yes, in the foot, they cannot sleep and so on. This is one form. We call it painful neuropathy, painful diabetic neuropathy.
Painful,
But this is only one group. It's about 20% of the patients with diabetes, they have this type of neuropathy, which is painful. But another problem is a non-painful neuropathy, which is very dangerous in terms of prognosis, because if you don't feel pain, you don't pay attention, and the process progresses, pathological process progresses, and finally in this non-painful diabetic neuropathy, we see huge problem which we call diabetic foot, and a lot of amputations, because we cannot help these patients because the stage is too late. And the problem of this group of patients is early diagnostic. In diabetes, this is very important to go and to be examined, maybe to make conduction velocity EMG study, because if we determine this type of neuropathy on an early stage, then we have chance to prevent this dangerous, terrible complication as diabetic foot. I should advise to go to neurologists and to make clinical examination first. And if neurologist see some changes in clinical examination, then he will decide what to do next, EMG or in order to be sure that the neuropathy is detected or not. And if it is detected, we'll start treatment program. If it is not detected, it is very important to make a very good personalized program of prophylaxis, physical activity, diet, and so on. There are clinical examination tools, there are tests, and there is EMG. It's a specific neurophysiological equipment which allows us to study the conduction of velocity of a signal of the nerve. This is the objective possibility to check up what is going on in a nerve.
This is nice. And doctor, now second question is that if someone have diabetics already and they started like diabetic neuropathy, so what the treatment, what the FDA approved for this treatment?
Yes.
Like if I don't have pain, what is the recommendation by the FDA? And if I have the pain, and what at that manner, what is the recommendation?
Yes, it's a difficult question because if you have, for example, pain, and we establish painful neuropathy, then there is a special group of medications which we use for the treatment in painful neuropathy.
Painful neuropathy, yeah.
Yes. And we try to combine these medications focused on pain management with medications and tools focused on regeneration process. Because the problem in the diabetes and in other diseases of neuropathy is the damaging myelin, the structure which is a part of peripheral nerve. So the symptoms of diabetic neuropathy depends on how damage is present. If it is severe damage, we have severe symptoms. It's a small damage, sometimes no symptoms. And the idea of treatment is not only to reduce the pain, which is very important, of course, but also to make some support, give some help to nerves to regenerate.
No, this is
now the issue.
This is again the one things come to our mind. Are the nerve regenerate, or this is like just something is anything that nerve can regenerate?
And this is very interesting story because when let me remind for all of us that the peripheral nerve, in a very simplified mode, is built by axon and myelinated cells around him. And these myelinated cells were described many years ago in the 9th century. But nobody knew that these cells, they're very important in the process of regeneration. And when they are damaged, they start to reprogram their function and they start helping to self-repair. So this is a universally interesting program in peripheral nerves, which can help to restore nerves themselves.
This way. So, is there any myelin only damage, or like other part of axon is damaged? Like there will be, like for example, regeneration happen in the axonal part, myelin part, or cell body or dendrite, where it will be like?
In any part, in any condition of damage, these myelinated cells, they take care for repairment of all structure of nerves, as well as axon, as well as
axon
myelin.
is also there. So it means that if they regenerate, so they will be again functional in the way. So there will be if any, for example, any medicine claim they are doing, or any supplement they claim that they can regenerate it. So how you can feel in the objective way, because in the observational you will see that maybe some scales are there, So any like nerve conduction velocity will
Yes.
improve if you are
Yes.
regenerated.
Usually, if you want to control how this process is going on, the regeneration, usually we use EMG, this neurophysiological examination of nerve conduction velocity. This parameter is very important. It really relates to the function of nerve. If nerve conduction velocity is normal, it means that the peripheral nerve function is not
Not
impaired.
so it means the
If the conduction velocity is reduced, it means that it's some damage
damage of
in
the
the peripheral
so
nerve.
doctor, what we find out that even in our family people have pain and painful neuropathy, so they don't know about the damage of nerve. Definitely they go for the doctors, and sometimes there is a severe pain, so they use some product is called pregabalin or gabapentin or tricyclic antidepressant they are using for reducing the pain. Are these products are useful to regenerate or just to reduce the pain?
No, these medications we use only to control the pain. These medications, as gabapentinoids, as pregabalin, gabapentin, duloxetine, they act on a mechanism of pain, not on mechanism of regeneration.
So it
So
means
we
that,
use them only to manage the pain.
but this will be only for pain. So how it will be,
Exactly.
for example,
It's
long-term
not
patient? How can they? Do you have any other things available and add on?
exactly. The pain is the result of damage of sensory fibers. But they are damaged. We have to restore them.
Uh-huh.
Because if we don't restore, the pain will exist forever. And we'll have to give these medications forever, which is not a good idea for our patients.
Yeah,
So, together with this pain management program and
program, yeah.
medications, we need to support the process of regeneration. And unfortunately, in our practice, we don't have a lot of tools to improve regeneration. We have vitamins B, we have alpha lipoic acid, and that's it. But during the last maybe 10 years, and even more, we have quite a big amount of studies demonstrating that the combinations of nucleotides, there is a special group of molecules, compounds, which we call nucleotides, especially uridine and cytidine. These both nucleotides are very important medications to support the process of regeneration.
Good.
And there are many experimental studies demonstrating that if you give these nucleotides in patients with peripheral neuropathy, the process of recovery, regeneration facilitates, accelerates. And this is
Doctor, this is the something new for us that nucleotides is using. But what we see in our practice and in even the general, people are using mostly if they have any issue related to the nerve, they starting the B vitamins.
Vitamins B, especially vitamin B1, B6, and B12, these three are very important in terms of helping nerve to regenerate. But again, the input of these vitamins is not so huge to be happy that if you give these vitamins to a patient, you'll see very soon and quickly good response on treatment. This is a problem. We know vitamins for decades and we use them, but they are not enough. Unfortunately, even with deficiency state, with our deficiency state, of course, when we have deficiency state, we have to give the vitamins for sure, and especially in diabetic population, they have deficit of vitamins B. If patient took metformin, for example, in huge doses for a long time, they also can have this deficiency of B12. And deficiency of B12 is an mechanism also contributing to the neuropathy. So we have to keep in mind that not only diabetic mechanism, but the deficiency state also contributes to neuropathy. So vitamins are very important, but it is not enough to use only vitamins B for recovering, for treatment. We need something else. We have good results using the nucleotides as well in experimental studies and in clinical studies.
So it's mean that nucleotide, it is useful treatment for the patient have the diabetic neuropathy.
Yes.
In the combination,
Yes.
it will be helpful to reduce the symptoms
I
of
think
the
so.
thing. And do you have any suggestion for this is safe or we can use?
Yes, again, many studies demonstrate that this group of medications, nucleotides, are very safe. They are not dangerous for the vessels, for the heart, for the stomach, for the kidneys, for the liver. So this is the very good news, I should say, for our patients.
It is.
And you can combine them with vitamins. You can combine them with lipoic acid, with other medications if you need it. So this is the advantage. The question is very good, but we don't still have this type of study comparing this.
But on your clinical
combination.
experience, what do you
From clinical experience, we always combine, let's say, pregabalin, gabapentin, or duloxetine, these drugs to control the pain together in parallel with vitamins, with alpha lipoic acid. And now we start using big dosages of nucleotides because big dosages demonstrate better effect on regeneration than small dosages. And very interesting additional effect of nucleotides is analgesic effect, which was not evident from the beginning. Because when we started our clinical experience with nucleotides, the main idea was to help nerves to regenerate, as we said, not to reduce the pain. But during the clinical studies was observed that if patients take nucleotides for peripheral neuropathy, the pain is reduced. It is not strong analgesic effect. We have to be serious here, but it has a mild, let's say, or moderate pro-analgesic properties, these nucleotides, which is very good news, I should say, for our patients.
This is the really is a good thing because we don't think that it has an analgesic effect. When we're discussing about the regeneration, we are talking about the long term. Regeneration take for the long term. If you are giving, for example, nucleotide, uridine, cytidine, what we are expecting that it will take a long term. But when you are talking about they have analgesic effects, so it will be used for other condition like compressive disorder. People have the carpal tunnel syndrome. They have sciatica or back pain. So they have any role in the back pain if they can use like the uridine in your clinical experience?
Yes, we have our clinical experience, and we conducted some studies and demonstrated that even in the low back pain conditions with radiculopathy or without, I mean with nerve compression or without nerve compression, if you add to the treatment nucleotides, you achieve better results than without them. So usually all practitioners use NSAIDs, non-steroidal analgesic, acetaminophen for pain. It's our practice. But what we have found and we demonstrated in our studies, not only in Spain there was interesting study recently published. If you add nucleotides, you have additional positive effect in terms of duration of treatment, reducing the pain, improving the regeneration.
People are using some pain relieving, NSAIDs are there, but it will be having so much, side effect. So how long we will use for this pain? Do you have any other option we can use it?
Yes, usually we use NSAIDs during 5-7 days if we face acute low back pain. But you're right, they have a lot of side effects from the stomach, from the vessels, hypertension, and they have a lot of contraindication.
Yes.
So it's effective medication, but not safe for everyone. And in this situation, we have, again, good news that this group of nucleotides, which we are talking about, they can give help in this problem as well. In some group of patients with low back pain, we can combine NSAIDs with nucleotides.
Okay.
If we see some dangerous questions regarding side effects, we can try with nucleotides. And there are different products in the world with nucleotides. It's Nucleo in some countries, Celtican, and recently absolutely new combination appeared, which is called Nubit. It's a high dose of nucleotides, Uridine, and high dose of another nucleotide, which is very important, cytidine. These two nucleotides, the most studied nucleotides in terms of regeneration and in terms of pain. So this is very good product for those who don't want to take the NSAIDs and they have some low back pain, but not very severe pain. We have to take
like
care.
mild
Moderate pain. We can try Nubit without NSAIDs.
Good.
We have a good experience, but again, in this group of patients with low back pain, with radiculopathy, with nerve compression, without nerve compression, we performed studies and demonstrated that it will work in both cases.
Doctor, one more interesting thing you had discussed about the muscle relaxant. So muscle relaxant is, so some patients have the back pain because of the muscles, muscle spasm. So this molecule, this nucleotide, uridine, cytidine, and as you said, the Nubit, it will be work for the patient who have the muscles pain. Not the compression. There is no compression, no radiculopathy. This is something different.
This group of drugs, which we call muscle relaxants, they have specific mechanism of action on the mechanism of muscle spasm or increased muscle painful tone. So nucleotides, they are not specific muscle relaxants, but what was found in the special studies that nucleotides, along with this potential to promote regeneration, they have, let's say, independent property to reduce the pain, and this action is possible through acting on a specialized purinergic receptors in nervous system. And in this term, nucleotides are regarded today not only as a support for regeneration in neuropathy, but also as a medications with not huge but moderate input in pain management in different pain syndromes.
Okay.
As a perspective.
Perspective.
I would like to thank you for inviting me to discuss this very important issue, because the pain is a huge problem.
This is very important point, doctor. Really, I appreciate your insightful knowledge of the pain and all the nerve, especially when we talk about the acute and chronic pain, because some pain are good as well to you find out the underlying conditions, and you need to be treat the condition, not the pain. So this is a very important message for today discussion, that you have to be see what is the underlying condition and working on this underlying condition to treat the disease. Thank you, doctor, for your kind participation, and it is always useful for our audience and all for the people who are listening across the globe. Goodbye from our side. Goodbye, doctor.
Thank you so much.